Now, anything that we get a little bit compulsive to or we can't break a pattern of can be viewed as a sort of addiction. We look at any kind of label as a spectrum. Because of this, these upcoming skills can be helpful to everyone in some way. If you do have a difficult addiction that you are struggling with, I highly encourage that you get a support group and a therapist that is well vetted in your issue. I personally am well vetted in treating disordered eating and would love to help you on a one-on-one basis if that is something that you are suffering with. Please reach out via email so we can set up an appointment. There are 7 basic skills for addiction-related behavior. These include dialectical abstinence, clear mind, community reinforcement, burning bridges, building new bridges, alternative rebellion, and adaptive denial. These 7 skills focus on backing down from addiction. They can be remembered by starting at D and reciting the alphabet backwards. D, C, B, A. D, dialectical abstinence. C, clear mind and community reinforcement. B, burning bridges and building new bridges. A, alternative rebellion and adaptive denial. The definition of addiction is very broad and includes any repetitive behavior that an individual is unable to stop despite the negative consequences of the behavior and the person's best efforts to stop. Individuals may have more than one addiction, but it is usually most helpful to focus on one addiction at a time. Scientists have traditionally confined their use of the term addiction to substances that foster physical dependence. That's changing, however. New knowledge suggests, as far as the brain is concerned, reward is reward, regardless of whether it comes from a chemical or an experience. And where there's a reward, as in gambling, eating, sex, or shopping, there's a risk of getting trapped in a compulsion. Once people get addicted, the pleasure of addictive behavior may actually decrease, but the urge to engage in the addictive behavior will not only increase, but will intensify. At this point, the addictive behavior may become reinforced not by pleasure, but by relief from the intense and unpleasant urges. Some people say that when they engage in addictive behaviors, they feel normal again. In these cases, behavior that may have started with positive reinforcement, meaning it gave pleasure, comes to be maintained by negative reinforcement, meaning it stops unbearable distress. In adaptive denial, you convince yourself that you don't crave the addictive behavior. For this to work, you must be adamant in telling yourself that you don't have an urge for the addictive behavior. When addictions function as rebellion, giving up addiction could be hard because it implies that you need to give up rebelling. With alternative rebellion, you can satisfy the wish to rebel without destroying yourself or blocking your way to achieving important goals. Alternative rebellion means finding another rebellious but non-destructive behavior to substitute for addictive behavior. Addiction as rebellion is ineffective. It does not help you towards your overall goal of higher quality of life. Rebelling against a person, society, rules, boredom, or conventions with addictive behaviors is cutting off your nose in spite of your face. This is the opposite of mindfulness how skills of effectiveness. Alternative rebellion means rebelling effectively, finding a new way to honor the desire to rebel in a creative way instead of suppressing or judging it or mindlessly giving into it through addiction. Adaptive denial refers to adamantly convincing yourself that you don't want to engage in addictive behavior when urge hits or when that addictive behavior is not a possibility. Give logic a break when you're doing adaptive denial. Don't argue with yourself about believing that the urge is not there or that doing the addictive behavior is not possible. Convince yourself that you want something else other than the addictive behavior. Put off addictive behavior. Put it off for 5 minutes, and then put it off for another 5 minutes, and so on. Each time, tell yourself that you only have to stay in this for 5 minutes. Do not replace cravings for one addiction with cravings for another addictive behavior or for behavior that is itself self-destructive. Remember that replacing cravings for one thing with a craving for something else is to be used only in a crisis when it appears clear that you are able to tolerate intense cravings without giving in to them. Suppressing desire over the long run increases the level of desire rather than reduces it.